All right. Good morning, everyone. My name is Dominick Kennerson, and I'm the global head of Bayer's G4A, and I'm based in Berlin. Today, I'm really excited to share with you some of what we've seen and learned about COVID-19 and investments over the last year or so. Just by way of introduction, a few words about myself. So, I am from the United States, from Washington, D.C. I've been hugely interested and I've worked in digital health all the way back in the early days of 2006 for a company called Revolution Health. So I'm hugely excited about this topic and excited to share a little bit more about you and how we approach this topic at Bayer. And the way I'm going to do that, I'm going to describe to you some of the major ecosystem drivers and trends that we see and the lenses that we look through. I'm going to talk a little bit about the new digital health dynamics based upon COVID-19, and then how that really impacted digital health investment in 2020 and especially in 2021. And then finally, the context about G4A and how we try to capture some of that value for investment and partnership in the marketplace. So first, so there were already certain elements in play pre-COVID, and the lenses that we looked through and that we were thinking about pre-COVID were already social determinants of health. We were already, as an ecosystem and as an industry, in an artificial intelligence spring. This artificial intelligence spring, so to say, was already driving the public policy and regulatory environment. We were already thinking about how to look at people or patients or the really big topics in health and healthcare, such as non-communicable diseases or NCDs, population aging and healthy aging. The conversation around healthcare's finances was really about spending and how to create more sustainable healthcare systems. What we have really seen since COVID is that it has really shown, I think, a bit of a spotlight on NCDs. I think we're very much familiar with that. It has exposed, of course, an increased spotlight around healthy aging and the elderly. What's I think a little bit more interesting around the healthcare financing aspect is that it's been less about spending and much more about investing. And what we've seen from an investment perspective, is that we all of a sudden have a number of examples of market validation, very deep value pools, new valuations, and very high valuations. Throughout this presentation on the next several slides, I will go a little bit deeper into social determinants of health, what those mean, and how those have played out in COVID-19. We do call this an artificial intelligence spring because some people kind of miss that artificial intelligence has existed in healthcare for over 30 years or so. The public and policy and regulatory environment, especially related to artificial intelligence, I think has been hugely important running in the background through organizations such as the World Intellectual Property Organization, as well as the US Patent and Trademark Organization. So part of what we saw through the pandemic, and I think even now, is that there were really two elements or a push-pull dynamic uh, where COVID-19 really spurred the momentum for digital health. So we did see huge numbers of increased adoption for digital health, and then a mindset shift amongst health consumers. And then on the pull side, again, the social determinants of health aspect. So social determinants of health being everything in your community or in your life that impacts or influences your health. This social determinants of health aspect, I think, really takes into account the World Health Organization definition for health, that health encompasses not just, well, it actually encompasses everything from your mental health, your well-being, and your actual health status. We talked already a little bit about the health economics challenge, and I'll go deeper into that. It also created a need for integrated care, and I think um, showed how integrated care solutions can positively impact health. And then for us and the lenses that we look through, we did see an increased need for digital health solutions in key areas such as cardiovascular disease, women's health, mental health, and oncology. So some of those highlights and kind of on the adoption and where digital health is right now, maybe 5 key points. So in from 2020 to 2021, 44% of people are using devices or apps to help manage their healthcare remotely. We saw a 25% rise in digital health app downloads since the beginning of the pandemic. That was in the United Kingdom. An increased proportion of people tracking at least using some metric for their healthcare digitally. And then even uh, throughout and post-pandemic, people are planning to continue to use digital health components such as video appointments or telehealth and telemedicine. And there is an increase in some of this technology, and we have some. I have a few additional data points that will drive that home. Um, those different pillars for social determinants of health, it was pretty clear in the United States that Black people were twice as likely to die from COVID-19 compared to others. In Germany, the mortality rate um, for COVID-19 increased significantly for the second wave. We also saw on the health economics challenge a lot of deferred treatments. There was a significant impact to traditional ways of capturing value from a provider and treatment perspective. We think that this will also have an impact down the road. So, for example, if someone did not go to the doctor and they did not have their cancer diagnosed, we have some data that suggests that a lot of people deferred from those kinds of appointments, and this, of course, can have a further impact on how um, public health systems or healthcare systems can actually finance future care. So on the integrated care side, we really saw the importance of cooperation between healthcare providers for public health and for actually providers at the point of care. So also this means a dissolving of the barriers that people see between departments, even in hospitals or between healthcare systems, between public health and actual point of care delivery, for example. And then we also really saw the need for real data in real time. And I think an example of that could be something as simple as a contact tracing app, for example. So what we really saw is that COVID-19 revealed some significant pain points. There was a push. This pull dynamic was really a vacuum around those different pain points. And digital health was really perfectly positioned to capture that value and to very quickly and rapidly change the way that people think about their health and healthcare. So this acceleration of digital health adoption through COVID-19, we saw a number of declined outpatient visits in 2020 compared to 2019. In-person visits dropped significantly, so of course we saw a huge rise in telehealth and telemedicine. And as already mentioned, we think that will continue in the future. Excuse me. Mental health providers also began using telemedicine for the first time. I think everyone's been at home, at least here I am in Berlin, we've been home for over a year mostly. And so everyone kind of sees the need to exercise their mental health a little bit more after living for a year differently. And then some of this in terms of adoptions, and I'm in the quadrant on the right. We saw double-digit increases, for example, in digital health tracking, wearable ownership, and live video telemedicine. Online provider reviews decreased slightly. I think this is probably mostly because, as already mentioned, the decreased office visits, for example, and then a decrease in online health information. And my only guess around the dip in this is that everyone in the world over the last year essentially became a novice virologist, and with all of the constant chatter, talk, and saturation for COVID-19, I think people, were probably just a little bit fatigued by that. Um, Now in the lower left quadrant, we see uh, absolutely around March this significant uh, decrease or dip in the change of visits, and we see that reflected in the opposite way in terms of telehealth on the right-hand side. So from an investment point of view, digital health is really in a completely new space from where it was 18 months to 24 months ago. Significant amount of capital raised, and this 21.6 billion comes from Startup Health. There are a few different sources for the venture funding number for 2020. The three that we go to the most are probably Startup Health, Rock Health, or Galen Growth. And those are probably pretty good sources, and they all count slightly different, but this 21.6 billion is pretty accurate. And what this really represents is a 55% increase from 2019 to 2020. What we've also seen in terms of deal stage is something that we have to think about, because at Bayer G. Freud, we make investments into pre-seed and seed companies and then normally explore partnerships in later stage companies. And so what we saw is that, especially in terms of series above Series A, so Series B, Series C, and above companies, significant value in terms of deal count and actual maturation of digital health. And I'll go into some of these examples another few slides, especially in terms of that Series D and Series E level. The highest growth segments were absolutely around telemedicine, as we can probably assume a bit. So 2019, 1.1 billion, $2 billion increase in 2020, and very similar around remote patient monitoring. And we have a few data points that point in that direction as well. So Q1 2021, so even outside of 2020, already in the first quarter this year, we have seen a significant increase in mega deals. So in Q1, we already had 8.5 billion invested into digital health across 210 deals, which is absolutely a record. So this year in 2021 is already on a record pace. And I think I will talk through some of the examples kind of from these slides, but one of my personal favorites is City Block Health, which really encompasses that social determinants of health aspect, and to me is probably the leader in that space. If we look at and focus on telehealth a bit, we can break down and see at least a large portion of that 8.5 billion in Q1 went to telehealth actually in the quarter. What we also saw very quickly in 2021 were some new unicorns in the telehealth space. And what's really interesting here, I think, is that all of these deals represent Series D and Series E deals. Excuse me. Hinge Health, a Series D, Dispatch Health, a Series D, K Health, Series E, Vaser, Series D, Modern Health, Series D, and Evidation, a Series E. So this again shows the maturation of digital health and how COVID-19 has just, I think, from end of 2019 to where we are now, the industry has probably accelerated 5 years quite easily. And then another deep value pool around mental health. So mental health, we've already seen several mega rounds from 2019 to 2020. And I already mentioned kind of the way we're experiencing this in Germany a bit, but 1 in 3 US consumers reported that COVID-19 has impacted their mental health. So essentially a third of the United States. People are reporting a rise of stress, anxiety, depressive disorders. And so we also see money going into later stage deals. Some of the examples from Q1 already are Lyra and Ginger. And what this also suggests is that investors are looking at very distinctive verticals for investment. I think for investors that maybe haven't been in the healthcare sector or have a lot of experience there, these sectors like mental health, telehealth, and telemedicine are a bit more approachable because they are so consumer friendly. What we've also seen, especially in terms of integrated care, is how digital therapeutics are taking up a larger share of the investment. So we also saw the digital therapeutic space accelerate quite a bit. At Bear, the way we try to capture some of this value, whether it's around mental health, women's health, and that lens of social determinants of health that's governing kind of the way we see the digital health world, is health for all through digital health. And we essentially are looking for scalable digital health solutions to create impact, empower lives, and change the experience of health. So we see ourselves as a bridge between the digital health ecosystem and Bayer, and we're looking for commercial partnerships, later stage and early pre-seed to seed investments. So integrated care. So we actually have an integrated care approach at Bayer. And what this means, and through G4A, this means that we are looking at digital health solutions beyond a pill. So we're looking for better coordinated healthcare approaches for patients with comorbidities and associated conditions. So again, this builds on that social determinants of health aspect. We want to improve people's lives and help them play a more active and informed role in their healthcare. Integrated care also means that we're looking for ways to reduce inefficiencies in care management, and we also want to develop and support new solutions in business that are focused on human-centered design. And this is essentially what integrated care is. So it's not really just a bare term, but it's a broader term on science out of Stanford and BJ Fogg's work. Maybe some of you are familiar with the Tiny Habits book. So some of the ways in which we see those solutions evidenced in the marketplace is around cognitive behavior therapy, disease management, lifestyle and prevention. Of course, patient literacy plays a large role in that, care management, and even appointment scheduling solutions. So I mentioned a little bit that we're looking at digital health solutions beyond a pill. And so I think what's important and why that's really distinctive and unique to Bayer and G4A is when we talk about investing in digital health companies, many people, or I think companies, or sometimes even investors assume that we are looking at the space around clinical trials, which is completely not the case. We're looking much more forward at patient, or actually the word that we like to use is people-focused solutions. So those include virtual health. I already mentioned digital therapeutics, the wearable space, and some of those health information tools. We essentially have our partnership model and our investment model in those different spaces and areas set up for growth in advance. So track, so to say. So our growth track really focuses on Series Seed A startups that have an MVP validation or some early published findings. We offer a 20,000 to 100,000 euro convertible loan investment. We also offer co-working space pre-pandemic at our campus here in Berlin, which is hugely important, I think, when people are thinking about networking with Bayer or finding other experts to maybe provide some insight into their business and how to potentially grow that. So absolutely connected to that co-working space is the executive mentorship and coaching aspect to our growth track. And these executive mentors and coaches come from both inside and outside of Bayer. The executives actually include members from our executive committee that are actively involved in coaching startups that fit the profile for our growth track. In the advanced track, we are normally looking for partnerships. These are definitely Series A plus companies. Last year, we actually had a Series D and a Series E company as part of the advanced track. Of course, they already have revenue, significant traction, well published validation and clinical studies. So maybe by now you're wondering, okay, well, what are those areas? I already mentioned a little bit: women's health, cardiovascular disease, oncology, and mental health. So these are our different challenge areas for 2021. And just to give you maybe a flavor in terms of what's under those challenge areas, of course, you can go to g4a.health/partnerships and you'll see them outlined there. But for example, in women's health, we're actually looking for screening and diagnosis solutions around bone health. For cardiovascular disease, we're looking for digital health solutions around lifestyle and behavior change. For oncology, we're actually looking at digital health solutions that can identify patients around digital biomarkers, for example. And mental health is pretty broad, but anything that can help reduce stress, anxiety, and essentially provide a prevention or management for um, mental health diseases. And just kind of building on that and why we see that as hugely important. So in COVID-19, what we saw is higher rates of chronic cardiovascular diseases. So again, I mentioned earlier, people postponing care or neglecting self-care to a degree. We have also the conversation around COVID-19 survivors and different comorbidities has also shown the importance of cardiovascular and cardiometabolic diseases. I mentioned in oncology the delayed diagnoses. And so, for example, in UK and US, there were huge decreases in cancer incidents that were documented. And of course, in terms of it from a value and financing perspective, oncology and immunology spending is expected to essentially hit a low double digit percentage CAGR. Also, I mean, we kind of mentioned earlier some of those doctor visits that did not happen in 2020. Women, of course, comprise a large share of that. I've always thought of women as like the chief health officer, and generally, women go to the doctor much more than men do. And I think in the US, this could also be connected to job loss and the job loss rate uh, for women in countries such as US and India. And again, we've mentioned this mental health stat a bit, how people are reporting increased rates of depression, anxiety throughout the pandemic, and suicide, even amongst young people, went up significantly. So, just kind of to bring it to a close, um, part of what we try to do and where we have already evidenced some of that is in companies that we've invested in. So, actually, last year in November 2020, we invested in our growth track, a company called Ellie, which is an empathetic audio companion for patients with chronic disease and a chronic disease um, uh, audio companion that is artificial intelligence driven. And then Karia, probably one of the first of its kind um, menopause platforms, which also includes a community of women. In the advanced track, a company called My On Care, which is a digital health platform uh, for cancer patients to help them orient their care. Decipher Biosciences as well, which is outcomes driven transcriptomics, and then Speech, which is a hugely powerful AI behavior change platform. And so uh, to bring it to a close, I would highly encourage you to visit our website, gfrey.health, if you know entrepreneurs, investors, thought leaders. We're always looking to share ideas, deal flow, and of course, encourage you all to check out our 2021 challenges so that we can change the experience of health together.